Gary Hargraves here, President of NIFA Medical Billing. We've been billing exclusively for non-MD first assistants for over 18 years now in 30 states. Don't you just hate it when your practice doesn't get paid by an insurance company or a patient doesn't pay? All too often, that's the problem non-MD first assistants have, not getting paid on far too many cases. That's the purpose of this video, is to explain why the problem exists and how you can help your first assistant. Basically, there are two problems. First, you may or may not know that with the exception of nurse practitioners and PAs, non-MDs can't bill Medicare. So if your practice is similar to most, you have somewhere between 40 and 60% of your patients are Medicare patients. All of those cases are done for free by the first assistant. So it's easy to see that it's imperative that the first assistant get reimbursed on the remainder of the cases so that they can afford to continue as independent first assistants. The second problem is that most insurance companies won't contract with these first assistants, so they have to bill as out-of-network providers in an in-network healthcare system. Even though we bill as out-of-network providers for them, we're able to get them reimbursed on most of the cases. It's on the remaining cases that we don't get them reimbursed for that we need your help. So what is the help that you, the surgeon or the practice, can give? It's allowing them to bill the patient. Now let us make it very clear, we're not talking about balance billing. Consider that if these first assistants were allowed in-network by the insurance companies, they would be obligated as part of their contract to bill the patients for co-insurance and deductibles. So what we're asking is that you allow them to do this as well. Nothing would be different, and the patients expect it. Where it would be different is when the insurance company doesn't recognize the first assistant's title and denies the claim outright, or the EOB shows that the insurance approves a dollar amount as an allowable, but it all goes to a large out-of-network deductible, therefore no reimbursement. But it's not the first assistant's fault that the insurance company doesn't recognize their title. So what we're proposing in behalf of the independent first assistant is to have the patient sign a patient responsibility and consent form at the time that they're in your office signing all of the other papers prior to the surgery. This patient consent form is one page. It tells who and what the first assistant does. It states, by the patient's signature, they agree to pay co-insurances and deductibles, excluding the out-of-network deductible, and that if the insurance company denies the claim or the allowable goes to this large out-of-network deductible, they agree to pay a reasonable fixed dollar amount out of pocket. Now, most of our providers that we bill for have set this dollar amount at between $200 and $250, and over the years we've had very few complaints. We'll handle all of the phone calls. From time to time a patient forgets that they signed the form, or they might have questions. So we'll take those phone calls. If they call your office, the person who received the call should have our phone number and refer them to us, and we'll handle it in a friendly and helpful manner. So if at the time of signing this form the patient gives the practice stiff opposition to signing it, then the first assistant would agree to waive this fixed amount. It's not a problem. So in conclusion, In behalf of your first assistant, we're asking your practice to allow your first assistant to bill the patients as described earlier, so that they can reduce the amount of cases that they do for free and be compensated for their hard and valuable work that they do for the surgeon and the successful outcome of the patient. They would appreciate it if you would consider this proposal. Thank you.